Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to Do most dentists in England use extraoral suction to take the aerosol? No.
No.
Okay, because nowadays it's quite famous in Indonesia and maybe some countries, but not all of the countries. But in Indonesia, we have a lot of extraoral suction. Myself personally, I don't use it because I use a double high volume evacuation suction already, so I don't think it's necessary to use the external suction. But I mean, after this, we are going to discuss about the AGPs because it's one of the most interesting topics. There's some journals that contradict to each other in this AGPs, and it's very, interesting. I mean, so and there's another question. Are you using air purifiers in your office?
Well, that's another question, isn't it?
Yeah.
Well,
No.
Because I don't think they're proven. My feeling is that it's better to stop the aerosol at its source with high volume suction.
I agree with you.
Wait for it to go in and then try and get rid of it.
You told me that to use hypochlorous acid or HOCl, right? And nowadays you can find in the market, you can find it in Amazon, you can find in the eBay that there's mist generators.
Yes.
For HOCl, and there's a lot of question regarding that. But I also have a lot of journals since you awakened me about the HOCl. Thank you. and HOCl is they are used until now in the food industry to clean the fruits before delivery. Yeah, and some journals also said if it's accidentally inhaled, it's safe. What do you think about that? What do you know about the HOCl?
I mean, it depends on the concentration because apparently they even put it in eye drops at low concentration.
Right.
So I think if you use 200 parts per million in a fogging machine, you can get rid of the virus particles within 5 minutes.
Yes. But unfortunately, there's no journals regarding the HOCl related to the COVID-19, right? But there's a journal that said that the HOCl have the same evac as a bactericide in the capability of killing the bacteria and the virus as the chlorine. And nowadays, WHO is suggesting us to use a chlorine to disinfect everything, like door handles and everything that have possibility of spreading the COVID-19. So if the journal said the HOCl have the same effect as the chlorine, so I think it should have the same effect to COVID-19. What do you think about that?
Yes, and I think it's quite easy to do it. I mean, as I say, the only paper that I managed to find was one that was done in chicken farms. But I mean, chicken house is much bigger than a dental surgery.
Yeah.
And they were using that against avian flu, which is not that similar. And they said it was very effective. Within minutes, they were able to disinfect the whole chicken house. So,
I read the journal about that. So,
yeah. So I think it's you can significantly cut down the fallow time, but you're also giving yourself peace of mind that to protect not only the patients but staff as well. You know, so
Yeah.
I think there's definitely some benefits, but you know, I think I don't know what's being done in the universities at the moment with regard to research. I actually am going to be talking to a friend of mine who's a professor in Portsmouth Dental Hospital, which is not very far from where I live. I'm going to talk to him and find out what the universities are doing, because also I don't know what it's like in your countries with the universities where they're teaching the dental students, but we have big open clinics in the dental hospitals.
Okay.
So it's going to be a problem, because how can one tutor look after all those dental students when they're all locked in individual surgeries?
Yeah.
It's very difficult for you to supervise that number of students to make sure that they're
So
looking after patients.
I've read the journals that say that regarding the HOCL, if it's like 50 ppm to 100 ppm, it's a food grade level. And for disinfectant, you need to make it like 150 ppm to 200 ppm.
Yes.
Yeah.
That's right. Yeah.
So it's completely safe, because I try, if I use chlorine in that same amount and I use it in my scrub shirt, which is black in color, and it should be like Dalmatian. I will be like Dalmatian in minutes, right? But I use the HOCL every day around the body, because I have the machine that creates, you know, by mixing distilled water with salt, non-iodium salt. So it's very easy to make.
Yes.
But the problem is there's not so many journals backs it up, you know.
So there's definitely real scope for people to do this, research it. But I mean, they've been using it in swimming pools for ages.
Yes.
To disinfect swimming pools, because it's safe, you know, it's non-toxic and it doesn't smell like chlorine.
Yeah.
So
it smells a little bit like chlorine.
Yeah, but not too bad.
Not too bad. But you know, there's a lot of patient. I mean, a lot of people that are afraid when we spray, you know, to disinfect the clothes. Yeah. When we spray the HOCL, and they thought it was chlorine, you know. And what are you doing to my shirt? You're going to ruin my shirt. It's expensive and blah 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 blah. I have an experience with that, with my patient. Yeah. She thought that it was a chlorine. So I need to show it to myself. See, it's okay. It's safe. It's practically safe. And anyway, we will leave the HOCL behind, and we are going to talk about AGPs. Yeah, it's a very interesting topics. There's a lot of opinion about how to do it. Well, in this case, I'm with you. I'm the same opinion as you. Let's prevent the aerosol coming out from the mouth, right? Rather than to use an extraoral suction. I'd rather change my handpieces to a micromotor handpiece, which backed by a journal that if you use a micromotor handpiece compared to turbine, you will decrease the amount of aerosol as 80%. So you have only 1/5 of the aerosol generated from a turbine handpiece. So if you have 1/5 and then you use a high volume evacuation suction, I mean, you will almost get them all, right? Almost get them all. Well, if you have an extraoral suction, you can do it. But you know, it's related to economy again. I mean, you cannot buy all of the things, but if someone sell this and someone sell that, how much money do you have? You don't even work for a month or two, or like your case, it's 3 months.
Yeah, this is the problem. I mean, I have one micromotor handpiece, but I have turbines because they're cheaper. But I did buy one.
Yeah.
And the reason why I bought that is because 2 reasons. First of all, it's quieter, and because I was going into the laser. I wanted to go more towards comfort for my patients.
That's right.
So because they're quieter, it's just less traumatic for patients. So I didn't buy it thinking about aerosol, but I'm thinking, oh yeah, I'm glad at least I've got one of those. But yeah, they're not cheap; they're expensive.
Yeah, it's maybe like 5 or 6 times the price of turbine handpiece, right?
Yes. But they're very good because they have very good torque. So if you want to cut off zirconium, it's really good for that. But yes, I can't remember what I was going to say now. Oh, lasers, yeah.
Laser, yeah, laser.
That's the subject.
Yeah.
So obviously, when we're doing caries removal with lasers, we are going to create an aerosol, aren't we?
Yeah.
So that's another big question because I want to be able to use my laser rather.
Of course.
So I think I believe that Photona might be doing some research at the moment.
Mm-hmm.
Because the way I was thinking about it was, well, lasers, we know lasers will kill microorganisms.
That's true.
So how much of the microorganism is going to survive in a laser aerosol as opposed to a turbine aerosol? So it'd be interesting if somebody could do some studies on that.
Yes.
Because if lasers are killing the microorganism, then maybe lasers are safer.
But I think it's still if the spray is related to the laser. If the spray is spreading out from the laser, is going out from the laser, I think it will not reach the laser.
No, that's the problem. But this is why things like isolite, if you have isolite, then you're covering the throat with that and it's sucking behind. So, you know, I think the thing is, we've got to be doing these experiments. Somebody has to get down and do the research and test, you know, how much aerosol are we actually. This is where the research needs to be focused on the AGPs.
Yeah, I totally agree with that. There's a question for you. How do you set I mean, do you ask your patient to pay for the PPE that you use for, you know, like do you change your PPE every patient?
Well,
what about the regulation of that?
Yes. Yes, you would have to change your PPE after every patient. So there is a cost factor that we have to think about. But there are some, like the reusable PPE, obviously, like there are some masks that you can clean. Yeah. Now the question is about the filters though. Yeah. But I've got a visor, so the question is how much of that aerosol is going into that filter.
No one knows.
Exactly. So, you know, it's all, the trouble is there's all this theoretical risk and there's all these regulations that are based on theory and not actual facts. I understand you though. It's like, well, we better do this because we think that might happen, but we don't really know. No?
For me, it's I don't want to compromise with the safety of this medical personnel and the patient. For me, well, in my practice, I change everything. I throw everything after use. Even the patient, I give the patient a disposable surgical gown, and we, the medical personnel, are using the coverall, full coverall. So every time I change patient, I change the sets of electric micromotor handpiece. So actually I have a lot. I have 30, so I can have 30 patients at the same day. Actually, it's impossible because my protocols in the clinic is a little bit complicated. We need like 30 minutes or 35 minutes to disinfect the room. We use fog. We used humidifier with AOCL, HOCL, and we even spray another disinfectant to the equipment and everything. Why? The reason why I use the fog, because fog is easy to fly, like the aerosol, right?
Yes.
We cannot be sure that the aerosol didn't come out from the mouth. So that's why we do some prevention measures, like those things. And what do you think about that?
Yes, I mean, I think also the important thing is the risk assessment as well. But yes, I do think, I mean, it's a bit like, my brother's an airline pilot actually, in the airline industry, which isn't doing very well at the moment. They have something called the Swiss cheese effect. So their safety measures are, if you put in layers of safety, and the more layers of safety you have, obviously the less chance that the holes are all going to line up.
Yeah.
So it's when all the holes line up, that's when you have the disaster. So if you've only got 2 layers of protection and the holes line up, you've got the problem. So this is why we've been asked to produce our standard operating procedures, so that we're basically taking the patient journey from when they're at home and following it the whole way through the practice. So they're at home, you do remote triaging and medical history and everything there to limit the amount of time they have to stay in the practice. You also risk assess them to find out if they're in a high-risk medical category or age or something. Then you can put them in the appointment book at the right time of the day to minimize their risk. You tell them to try and come on their own, or maximum 1 person with them. You measure their temperature when they arrive at the practice, and maybe pulse oximeter as well, to make sure they're well. And if they're not allowed to be seen. You check their contacts over the last 2 weeks to find out if they've been in contact with anyone.
Lindsey, there's a question for you, another question. Do you need to have a certain license to work with laser in the UK?
We have to have our practice assessed by, it's the same as a radiation.
For x-rays?
Yeah, so that inspects practice and then issues a certification. So yes, we do really. We're certified that we're safe.
Okay.
Before they come to inspect. So yeah, and then every year I have to be recertified. So
recertified.
Yeah.
And if you have like a master degree from the UNICAT, for instance, can you just show it to them, or you need to be inspected again?
No. Oh well, if they've inspected once and they're satisfied that everything has been done properly and all the documentation is there and everything, then my called LPA, he said, providing I'm satisfied that it's safe, he's happy to certify me without necessarily revisiting, unless there are some issues that need to be checked. But if I send him all the dimensions of my surgery and what I put in place for protection, providing that ticks all the boxes, then he's happy to certify me without having to revisit the practice. So yeah, but it was a bit of a nightmare when I first got the laser, because there aren't many people using lasers in the UK, and so going for advice on what to do was really difficult. So I think that there definitely is some scope for someone to offer advice for dentists, to say, look, we can make that journey much easier for you, because we'll be able to give advice. So yeah, exactly. But how does it work in your country? Do you need to do that as well? I
don't know. Actually, there's some some regulatory body that said that maybe not a regulatory body. It's just some dentists, some people that mentioned that it's for a specialist.
Okay.
But the problem is, in the university, I have no idea if they're being taught about laser like we do in the university. So I really want to know actually here. So and for some dentist, laser is just a tool, in here.
Yeah. Well, it is really. It's just a different way of doing things, but you can go and buy a laser in this country, even just a small laser, and start using it without any proper
education.
Yeah, but I mean, I went on a talk with it was just a local British Dental Association talk.
Yeah.
And there were some dentists sitting near me who had bought a laser. It was just a diode.
Yeah.
It's been in the box for 12 months. They were too afraid
decoration.
to use it.
They use it as a decoration, right?
And they were like, oh, but we don't know what to do. And I was like, oh my goodness, you've spent all this money on this laser. But they were afraid of it. And it is a bit scary when you first start off. But that was why when I bought I was very lucky because I had Eli as my mentor. But also, I thought, well, there's no point in me buying this laser unless I learn how to use it properly.
And Lindsey, by the way, I would like to welcome Gianfranco.
Oh,
here, Gianfranco. This is your thesis colleague here. And I saw that King is also here to watch our webcast. So, okay, Lindsey, because we have limited time, so what can you give our participant here as a take-home message to go through with this pandemic?
I think that we need more global collaboration between dentists to share our experiences, and so we can see what is the transmission rate amongst dentists in different countries and what are we each doing to try and limit the transmission in our different countries. Obviously we've got to look at the actual infection rate as a background, but then also to learn from this, because I do believe that dentistry was already quite safe.
Yes.
I think we were doing a lot of things right, and of course there was mass panic and dentistry, because we're so close to the patient. We need the scientific evidence to show us the way forward, so we don't end up in this situation again. Yeah,
actually I never locked down anyway from my work. I work every day since a long time ago. Well, anyway, Lindsey, before we're closing down the show, I mean, there's another question for you. Let me read it. Give it to me privately. So, what do you think about? It's back to HOCL. If we use it in our practice room as a humidifier, to generate mist, because mist can fly in the ceiling and everything, and also the aerosol at the same time. So we hope that HOCL can kill COVID-19, but we don't have any journals to back us up, except for the journals that mention that the HOCL have the same effect as the NaOCl or chlorine. So what do you think about that? That's going to be our last question for tonight.
Yes, I mean, we need to do a lot of studies on that, but I think there's definitely a place for that. I mean, I'd heard about this before actually, when probably about 2 years ago, when we had, because we have to do something called CPD. I expect it's the same in your countries, continual professional development. So we have to keep up to date with things like cross-infection control. It's mandatory. And we have to show that we've done regular updates in that. And so we had someone who came to our practice and spoke to us about it, and she mentioned that, and she said, you know, it's great because it's really effective and you can make it yourself. So it's cheap to make and it works really well. But we didn't really pursue that, which I kind of think, oh, we should have done really, but hindsight's a wonderful thing, isn't it? So I think, yeah, it's definitely, you know, we need non-toxic.
Yeah, definitely.
Kill the viruses so we can practice safely, because it's not just about killing the viruses, it's about not inhaling lots of nasty chemicals.
That's true. I totally agree with you.
Who knows what we all inhale with all the chemical stuff that we wipe down. I remember actually I had one nurse that was a bit fanatical about spraying everything in the surgery. She was like, spray anything. And after a couple of days, I started to get really bad headaches. And I had to say to her, look, I think you're just doing it a little bit too much because I'm starting to feel ill. Just like, I mean, it was got to the point where the chair was so wet that I was having to wipe it before the patient was used to sit in the chair.
Let's just hope that she didn't kill herself.
So I think, you know, there is a balance, isn't there? And again, it's about balancing the risk of the virus against the risk of us not being able to see our patients and treating the other dental problems that are potentially very damaging to people's health. You know, oral cancer diagnosis. Yeah. Gum disease that can be related to all sorts of other nasty systemic diseases, you know, potentially life-threatening infections. All these things we aren't being able to do because we're not being able to work properly and effectively. You know, we've got to weigh that up against the mass panic and also I think the media has not helped very much in our country because it's
Lindsey, I think I lost you here.
To like maybe later on. So, you know.
I think I lost you just a little bit.
Okay.
The connection.
Yeah, I think you moved.
I see like you are stand stiff. Like posing. yeah, like that. Okay, Lindsey, it's been a pleasure for me to talk to you.
Thank you very much for having me on.
Because I cannot see you. I was supposed to see you this May, right, in Rome.
Yes.
But unfortunately, we cannot. By the way, can you fly to different countries in Europe nowadays?
I can.
Is it open?
Our silly government has imposed quarantine when we get home.
Oh, 14 days.
2 weeks, I think.
Yeah.
So, yeah. I mean, it's ridiculous. They should have done that at the beginning, not now. I mean, we higher infection here than in some other countries, but they're actually quarantining us coming.
Yeah.
I don't understand that. But anyway, what do I know? Yeah, so I'm hoping that in a few weeks' time they'll realise the error of their ways.
Okay. Anyway, this meeting is recorded, and for every one of you that missed our show from our conversation from the beginning, you can watch it later in my YouTube channel at Imankusumadirja. You can find it in YouTube. And this conversation also live in the Instagram at the moment. And by the way, because we are running out of time, and I would like to thank Dr. Lindsey Whitfield, my friend, for having a very constructive conversation to enlighten us with information from the UK's. And there's also a lot of doctors here that says thank you to Dr. Lindsey for a very entertaining also, not just full of information and education, but also entertaining. And I would like to say thank you very much for all of the participants for staying up until late. This is 9:12 in the evening in Jakarta, and they're still very excited. And some of them say, text me in private, don't stop. It's not late yet. Okay. But unfortunately, we have to end the show. But don't forget, we will send you information regarding dentistry from all over the world. We still have a lot of guest stars from Australia, from Qatar, and from all over the world. It's still a secret, and I will inform you later. So one more time, thank you very much, Lindsey, for your time, for your passion in dentistry, for your friendship, and for this constructive discussion.
You're most welcome. It was a pleasure, and I really hope that we will all see each other, all the masters students. Yes. Actually see each other.
I think next year.
For a celebration. Yeah.
For celebration. And don't forget, in 2 days you have to submit your thesis. Okay, I will end the show. Thank you for staying with me, Imankusumadirja at Dentistry Talk. And I will see you in our next episode with more speakers, more special guests. Okay, I'll see you again. Thank you very much. Good afternoon for you, Lindsey. Good evening for all the people in Indonesia. And see you. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Bye-bye, everyone.
Bye.
Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to